Thank you very much for inviting me to such an important event to highlight the Egyptian National Hepatitis Response and the HCV Care Program. This is my disclosure. For many years, Egypt topped the list of the countries with the highest prevalence of hepatitis C based on the data came from the demographic health survey in 2008. The HCV prevalence was 15% regarding to the antibody level, while those who were viremic reached to 10% among the age group from 15 to 59. In 2015, the following DHS showed a decline in HCV antibody prevalence reached to 10% and also declining of the viremic patients to the level of 7% among the same age group. This decline was attributed to the deployed infection control programs and the exit of the highly affected group being more than 60 years old in the second DHS. Due to the high prevalence of hepatitis C, it was expected that the long-term complications of liver cirrhosis would affect a broad sector of infected people and reflected on the incidence of cancer in Egypt, which was topped up by the primary liver cancer being the highest incidence in males and in both sexes among different age groups. And it came in the second level after breast cancer in females based on the data of the Globocan in 2018 quoted from the National Cancer Registry. And sure, the final story was the reflection on the mortality trends showed the steady levels in HCC-related mortalities till the first half of 2020, and we hope that the service reduction under the pressure of COVID-19 will not lead to a surge of HCC-related mortality, especially in 2021. On the other hand, due to many years of efforts in fighting hepatitis C in Egypt, we started to touch the low difficult hanging fruits, the reduction in liver-related mortalities, which is an essential indicator for hepatitis elimination as per the WHO definitions. The national hepatitis response in Egypt had an exceptionally long history, many challenges and moments of victory. The high HCV prevalence in Egypt was attributed to the massive campaign of anti-schistosoma treatment with a parenteral therapy called the tartar emetics, which was widely used without sufficient needle sterilization and led to massive spread of hepatitis C. Egypt was one of the leading countries in Africa in the Middle East that adopted the introduction of HPV third dose vaccination within the context of the compulsory vaccination since 1992, and since that time the vaccination coverage is maintained to be above 90%. In 1993, the first ministerial decree was issued to make the screening of HPV, HCV, HIV, and syphilis mandatory for all the blood and blood products bags. This was followed in 2003 by the publication of the first national infection control strategy. Then, at a tough and challenging time, a very important decree for the establishment of the National Committee for Control of Viral Hepatitis to be the governing body responsible for drawing of a national strategy for prevention, diagnosis, and the treatment of hepatitis C. The first quick win of the committee was the introduction of pegylated interferon and ribavirin therapy for HCV treatment, which was the only available treatment at that time with a reduced cost enabled to treat nearly 350 chronic HCV patients with sustained virological response reached to 40 to 50%. Also through a network of geographically distributed viral hepatitis treatment center, that program is established and becomes effective on the ground. These viral hepatitis treatment centers are well equipped with diagnostic facilities and have a well-trained staff. The major breakthrough happened in 2014 with the introduction of the brands of the direct-acting antiviral drugs with only 1% of its global price. This group of drugs allowed for treatment of many easy and difficult cases with shorter duration and minimal side effects compared to big interferon ribavirin therapy. This was associated with the kickoff of the national network for the treatment centers and the initiation of the web-based registration system, which allowed for electronic reservation of appointments at the nearest viral hepatitis treatment center for the evaluation and treatment. Not only this, but also the unified platform for data entry for all the patient journey. The second major shift happened in 2016 with the introduction of the generics of the direct-acting antiviral drugs, which are locally manufactured in Egypt and provides us more deployment of HCV drugs and allowed for treatment of nearly 2 million HCV patients. Concomitant to this, an important step was done, which is the introduction of HPV first dose vaccine to enhance the prevention of the mother-to-child transmission of hepatitis B. In 2017, it seems that we treat all those who knew their status of infection, and the number of patients at the viral hepatitis treatment centers started to decline, and many trials for limited and targeted screening were done to discover any patients. Yet we knew well that we still had the bottom of the iceberg containing from 2 to 3 million hidden cases of hepatitis C that need to be discovered. For that reason, Egypt started in October 2018 the most extensive nationwide screening campaign for the elimination of hepatitis B and early detection of non-communicable diseases, which was performed in a time period of 7 months through 3 phases. Each phase included a group of urban, rural, and border governorates. The total number of screening sites is nearly 7,500 sites. The screening was mainly done at the primary healthcare units, which has a perfect geographical distribution. It accounts for 77% of the healthcare system facilities shared in the campaign. Added to the primary healthcare unit, and extra support was done through different secondary and tertiary hospitals, mobile clinics, and mobile teams to enhance the outreach programs, primarily in the border governorates. Beside the sharing also of non-health facilities like youth centers. We had nearly 20,000 teams. Each team consists of 1 medical staff and 1 nursing staff and 1 data entry staff, with a total number of healthcare workers reached to nearly 60,000 healthcare workers shared in the campaign activities. Regarding the training, we adopted the model of the training of the trainers through training of 5,000 healthcare workers on the ideal methods of HCV testing using the rapid diagnostic tests. Every one of the core trainers was responsible for the subsequent training of 10 corresponding persons to do the same job. The campaign was performed over 7 months with an average daily screening reached to 240,000 people underwent HCV testing per day. The test results appeared from 5 to 20 minutes, and those who were tested positive, their confirmatory PCR samples were done in 77 PCR testing hubs with an average daily capacity reached to 36,000 tests per day. If we have an in-depth look for the screening journey, which was pushed by a huge media campaign, included all types of media tools like TV, radio, billboards, social media, and celebrity promotions. Any person could go to the nearby primary healthcare unit or any nearby hospital to be tested. And we had a 24/7 call center and the hotline that had a great human capacity, allowed for communication with people to notify them with the nearest point of testing based on their residence. After going to the testing point, the person should present his or her national ID, which is a unique identifier to be recorded. And if they previously received the treatment within the public sector, the system generates a message that this person is not eligible or allowed to be tested again. After that, the test was done and the results were double recorded on the electronic data system and also in a pre-designed card. If the person tested positive for HCV antibodies, the system generates a message including the name and the address of the nearby viral hepatitis treatment center for further evaluation and the treatment of those who are eligible. At the viral hepatitis treatment center, which are more than 200 centers, verification of data was done firstly, and the withdrawal of the blood sample for assessment of HCV RNA and other liver function tests, plus abdominal ultrasonographic examination was done. The PCR samples were collected and transferred through a specialized courier to the PCR testing hubs without further movement of those who are tested. These PCR testing hubs were installed in respect to the geographical distribution and also the expected samples to be received. When the test results appeared, it was automatically sent on the lab information system, which could be viewed directly at the viral hepatitis treatment center. And if the patient is treatment eligible, then he receives the direct acting antiviral drugs for 3 months. And after finishing the treatment by 3 months, the SVR test was done through the same mechanism And also periodic phone calls were done to recover the patient with missed visits. Those who achieved the SVR were issued a cure certificate as one of the promotional actions to push the patients to come back for SVR testing. Uh, now it's my pleasure to uh, introduce you one of our heroes in this campaign. He's one of the data entry personnel, and he have a congenital absence of both his upper limbs, and by the toes of his feet, he could do full data entry for more than 1,000 persons shared in the campaign. I think this spirit and ambition was the leading cause for the success of
على
the
كتاب
campaign.
بدخل بيها كل شيء، حتى لو احتجت اعمل اي حاجه، ارد على التليفون مثلا برجلي، احط السماعه في ودني، كل حاجه بعملها برجلي اليمين اللي انا بقول عليها اصلا ايدي اليمين مش رجلي اليمين.
There was a great integration between the simple data system at the screening sites, which had a great integration with the national network of the treatment centers and also the lab information system, in which we could easily track the patient journey from the screening site until the final cure. The screening campaign was funded through the World Bank, and by the way, I am always saying that we received the first US$ 2 weeks after we finished the screening campaign, and all what we paid, although was through the mobilization of the domestic funds. At a specific time before the campaign, we had to choose between two pathways for testing with no considerable difference regarding the costs, either to go for a simple method for screening, which gives you a privilege of rapid movement and service deployment can be easily done by any healthcare worker, or to go for lab-based usual methods, which could hardly done on this large scale with expected huge amounts of blood samples transfer and processing and limited capacity for outreach. Finally, we prefer to go for the easiest and simple method to do the rapid diagnostic test technology, which allowed us to win this battle. Among nearly 2.2 who were tested positive for HCV antibodies, 1.6 million patients were transferred for the PCR testing at the viral hepatitis treatment centers, and the rest of people preferred to go for the private sector to be managed. 72% of those who are tested positive for antibodies were viremic by PCR, and 92% were eligible for treatment and received a combination of sofosbuvir and daclatasvir plus or minus ribavirin for 3 months, with an overall sustained virological response reached to 98%. Under the pressure of COVID-19, all the healthcare facilities in all the affected countries worldwide suffered from the transformation of their health capacities to serve the pandemic facing. In Egypt, to try to maintain the healthcare capacities and avoiding the collapse in health services by the gradual utilization of hospitals and manipulating the operation of other non-health facilities like hotels and dorms to evacuate the mild cases. Meanwhile, the utilization of fever and chest hospitals as triaging points and testing points responsible for clinical evaluation and assessment of those who have symptoms. That particular step affects the national hepatitis response and its related services like HCC surveillance system, because most of the viral hepatitis treatment centers and all its diagnostic and treatment capacities are lying inside the fever hospitals, which are used to face the COVID-19 pandemic. And if we look to this representative graph showing a nearly 60% reduction of the governmental funding decrease for all health services related to chronic diseases and surgical interventions due to the reduction of service accessibility and service demands, this stimulus arouses the governmental response to re-push this service offering and the community mobilization to re-receive it again. And for example, if we compare the period from December 2019 to March 2020 versus the period from May to August 2020 regarding the stability and the progress of HCV screening program, we could find a significant reduction exceeding 70% in the total and the monthly visits, and also the monthly performed ultrasound examination for early detection of HCC under the pressure of COVID-19. and now utilizes those installed systems to improve the testing capacity of hepatitis B, HIV, and also COVID-19. And now with the utilization of this big data, we could exclude anyone tested positive either for HCV or HIV or HBV at any time from the blood donation to save time and efforts for further screening. I will finish with this slide summarizing an updated situation of the WHO definition defined elimination pillars in Egypt, showing an optimum coverage of HPV third dose vaccine and first dose also, screening of 100% of donated blood bags, mandating the use of auto-disabled and auto-destructive needles in all healthcare settings, a significant move in the harm reduction file through the legalization of the opioid substitution therapy program, and the strengthening of the needle syringe program, achieving a great success in diagnosis and treatment of hepatitis C, reaching to more than 90% incidence reduction, and also about 20% reduction in viral hepatitis-related mortalities, and we expect more in the next coming years. No words will be sufficient to thank my colleagues in the National Committee for Control of Viral Hepatitis, the Ministry of Health and Population in Egypt, WHO, country, regional, and HQ, and our colleagues in the World Bank, and the legendary team of the Hepatitis Elimination Program, and the true heroes, the healthcare workers shared in the campaign, and the teams of the Viral Hepatitis Treatment Center. And thank you very much for your attention.